Next, I call Dr. Durga Priyadarshini.
A very good morning to one and all. So my paper for today is Neuro-ophthalmic manifestation of acute demyelinating encephalomyelitis in Indian pediatric population. ADEM is characterized by encephalopathy with multifocal CNS demyelination, and its diagnosis is based on clinico-radiological correlation and exclusion of conditions that mimic ADEM. So objective of the study was to analyze children diagnosed with ADEM presenting with neuro-ophthalmic manifestations. We looked into the data between June 2018 and May 2023, and we included children less than 17 years of age who had presented with the neuro-ophthalmic symptoms with acute or previous history of ADEM and who did not fulfill the diagnostic criteria of MS and who had come for at least one follow-up visit post-treatment. It was a retrospective analysis, and the sample size was 14 patients, and the following data were collected. I'm sorry, I think you have taken the wrong presentation. The PPT, can you see the? Okay, let's move on. Yeah. So,
Again, there is problem.
sorry, ma'am. I think the wrong PPT was uploaded.
May I
Can
request audiovisual people please come once?
Ma'am, can I re-upload the PPT?
You can take your time. You can just go and
Next
check your
presentation
presentation. Yeah, you can do the
I'm
next
sorry
after,
about it. I think the wrong PPTs have
I
been
think the
uploaded.
next person,
Thank you.
can do the presentation. Yeah.
I think again there is problem here.
Nayanika Bose. Yeah, I think we move the
I
tables
think
on
better
that side
we should go on this
rather than telling them repeatedly. Audio visual. Shift the table on that side.
Neuro-ophthalmic manifestations of ADEM in Indian pediatric population. It's characterized by encephalopathy with a multifocal CNS demyelination, and its diagnosis is based on clinico-radiological correlation and exclusion of conditions that mimic ADEM. So the objective of the study is to analyze children diagnosed with ADEM presenting with neuro-ophthalmic manifestations in Indian population. So we looked into the data between June 2018 and May 2023. We included children less than 17 years of age who had presented to a neuro-ophthalmic clinic with acute or previous history of ADEM and who did not fulfill the diagnostic criteria of MS and who had come for at least one follow-up visit post-treatment. So the sample size was 14 patients, and it was a retrospective analysis. The following data was collected. All patients had received IV followed by oral steroids. There was a female preponderance, 64% were female. The mean age of presentation was 8 years. Mean follow-up duration was 37 months. 57%, that is 8 out of the 14 patients had presented first to the ophthalmologist, and the remaining 6 out of the 14 had presented to neurologists, and then they were referred to ophthalmologists for opinion. Looking into the results, the clinical characteristics, 8 of the 14 patients had viral prodrome. Mean interval between ADEM and the visual symptom was 30 days. And the most common neuro-ophthalmic manifestation was optic neuritis. And the most common ADEM symptom that our group had was headache. The mean vision on presentation was logMAR 1.1, which was profound loss. But in the last follow-up, the visual acuity, they had improved. The logMAR mean vision on last follow-up was logMAR 0.4. And the p-value was significant. MRI brain and orbit was done in all patients, and all patients had ADEM-like lesions. And MRI orbit showed T2 signal in 12 out of the 14 patients, and 2 patients had contrast enhancement. MRI spine was done in 4 patients, and 3 of them had T2 hyperintense signal. And this is a classical MRI seen in ADEM patients and optic neuritis in one of our patients. And looking into the serum markers, 9 out of the 14 patients had NMO and had undergone NMO and MOG antibody, and 4 out of the 14 patients had only NMO antibody, and 1 patient did not undergo both NMO and MOG antibody. The prevalence of these seromarkers in our group, we noted that 5 of them were MOG positive, none of them were NMO positive, and 4 were negative for both NMO and MOG, and 4 patients were negative for NMO, but their MOG status was not known. And in this group, whose MOG status was not known, they were all classical ADEM followed by optic neuritis, and their visual prognosis was good. But the other group, the seronegative, who were negative for NMO and MOG, 1 patient was classical ADEM, but the other 3 patients had varied presentation. I have tabulated the 3 patients. 1 patient had presented with paraplegia secondary to myelitis, and we noted that all 3 of them had very poor visual prognosis in the last follow-up. looking at the relapse, 6 patients out of these 14 patients had relapse, that is 42%, and the most commonly it was optic neuritis, and 1 patient had recurrent ADEM. The average relapse interval was 3.75 years, and 2 patients had relapsed within 2 months, and obviously they relapsed when their oral steroids were tapered. 3 out of these 6 patients had MOG positive, and the 4 out of these 6 patients who had relapsed had residual ophthalmic symptoms, either in the form of visual impairment, persistent field loss, and pupil abnormality. And patients who had relapsed were all treated, had the treatment escalation and put on maintenance therapy. Going to the discussion, ADEM is a rare polysymptomatic demyelinating event which can present as vision loss secondary to optic neuritis and encephalopathy, which can manifest as headache, behavioral change, irritability, and lethargy too. There's a slight male preponderance in ADEM according to the literature, but our cohort had a female preponderance. Probable reason could be the association of pediatric optic neuritis with females. And the most common neuro-ophthalmic manifestation in ADEM is optic neuritis, which is very similar to the data published. And there is also something called as ADEM-ON. In current studies, they have noted that as a distinct clinical entity. 3 of our patients had cranial nerve palsy due to midbrain involvement. The association between MOG antibody and ADEM is very strong. In our paper, in our group, it was 35%. The subset of patients who were MOG negative, they were not classifiable under any defined disease entity, but the sample size is too small to comment on its significance. And the visual outcome in our group was very good. The prolonged inter-attack interval, especially in the MOG positive patients, indicated that they need long-term use of steroids or immunosuppressants, and none of our patients had relapsed when they were on maintenance treatment, but of course they need further studies to confirm these findings. So the limitation of our study is same as in any study which is retrospective. And I would like to conclude saying that ADEM can present first to any ophthalmologist, so one should be aware about this entity. Optic neuritis is a common manifestation of ADEM, and 1/3 can be MOG positive. Being a small cohort with a poor follow-up, it's difficult to conclude on the prevalence of pediatric MS, and this merits further studies on ADEM in Indian population. Thank you.
Very nice presentation. Thank you.